Hey guys, welcome back to Film Title. Today we'll talk about the most nauseating moments on Dr. Pimple Popper. Let's head into it. Number 1. Forehead. Dr. Sandra Lee helped 3 patients on this week's episode of Dr. Pimple Popper, including Felicia, a 47-year-old from Detroit, Michigan, who had a bouncing ball-sized bump in the center of her forehead. She describes the lump as soft on the outside, but hard on the inside, which she had for 3 years. Felicia stated that she tried to squeeze the lump like a usual pimple when she first spotted it, but just a small amount of clear liquid came out. That's when things went downhill from there. Felicia stated in the episode, referring to the fact that she now picks at the growth whenever she gets a chance, making it darker and more noticeable. Felicia used her collection of colored wigs, many with bangs, to conceal the development. Felicia expressed concern that having the mask removed might leave a conspicuous scar in the center of her forehead, preventing her from pursuing an acting career. Lee suspected a lipoma, a form of tumor that rests between a person's muscle layer and skin layer. After evaluating her, lipomas usually grow slowly and are modest, with a diameter of around 2 inches. Dr. P described the bump as nearly looking like a small nipple. She indicated that she'd have to remove just the proper amount of damaged tissue from the location, enough to make the discolored area unnoticeable to others, but not so much skin that a significant scar emerges after surgery. Lee began by making a small incision on the top of the bulge, using a surgical blade. Then she snipped the nipple section that was hanging off Felicia's forehead with scissors. Dr. P understood that some of the black and discolored skin would remain at this point. She predicted that it would mend and lighten to Felicia's normal skin and its color over time, but only if she stopped picking and pressing the area, because dense scar tissue stopped Dr. P from getting to the lipoma. After her first incision, she used her scissors to cut further into the mass. Lee was able to confirm Felicia's lipoma after a little more snipping, when Lee was able to bring it out in one piece with scissors. She said, "Oh, it's a cute one. It looked like a piece of shrimp," she claimed. Finally, Dr. Pimple Popper sewed up the wound and warned Felicia not to touch it to avoid further discoloration. Number 2. Inflamed elbow cyst. Dr. Sandra Lee healed a 25-year-old man with a rare genetic disease that left him with painful, uncomfortable, and bleeding-prone lumps around his nose and eyes on this week's episode of the TLC show. Juan from Tustin, California, came to Dr. Pimple Popper after many doctors failed to treat his genetic ailment, tuberous sclerosis, with inadequate topical creams. Tuberous sclerosis causes growths both within and outside the body, which can lead to various issues such as cognitive difficulties, cardiac problems, and epileptic seizures. As in Juan's case, he stated that his first seizure occurred when he was 6 months old, and he's been on seizure medicine since he was 10. That's when the benign skin growths started to appear, Juan explained. They started out as freckles, but later evolved into lumps that bled at random intervals. "I don't want to go out with people because of my condition," Juan said, adding that he believes his skin growths are preventing him from pursuing his aspirations, such as attending film school. Fortunately, Dr. P was able to assist Juan in regaining his confidence. When Dr. P met Juan, she explains that experts don't know why some tuberous sclerosis patients develop skin growths. Lee began by numbing Juan's silver dollar-sized lump at the end of his brow. She then cut a small incision in the growth using a little surgical blade. She peeled apart the incision with scissors, revealing a pink bubble beneath. Despite the fact that the bulge seemed to be a cyst from the outside, Lee said she had to take extra precautions because of Juan's genetic issue. After gently squeezing the mass, white pus squirted out, confirming that it was a cyst, a type of growth that forms a thick material when skin cells or oil become trapped beneath the skin. Lee then used a cauterizing pen to halt the bleeding so she could have a better look into the growth's cavity and make sure she got rid of everything. Dr. Pimple Popper moved on to the lumps around Juan's nose. After stitching up the cut she made near the corner of his eye, angiofibromas are little non-cancerous papules that form near the nose and are prone to bleeding. According to Lee employed another cauterizing tool to treat these growths, which both halted the bleeding and clipped the tiny nodules off the skin. The surgery was straightforward, but it was also nasty. Juan kept coughing as a result of the unusual odors produced by the procedure. "When I cauterize tissue, it produces a small amount of smoke, which is actually vaporized tissue," Lee explained. The aroma reminded her of getting her hair caught in a hairdryer, but according to Juan, the scent was worth it, and he was happy with the end of the outcome. The nose growth removal did not require any downtime or stitches. "Now that I have this clear, it will give me the confidence to pursue my dreams," Juan stated. This brings us to the end of our video. I hope you enjoyed it. Hit like if you did, and don't forget to subscribe to our channel so that you don't miss any of our videos in the future. Also, watch the 2 videos that are on your screen because I'm sure you'll love them. With that, I'll see you in the next video.